Good morning, everybody. It is, what's the date? September 28th, 2020. It's 9:30. Time for class. It was 50 degrees this morning. Fall is here. Supposed to be about 39 overnight in Boonville later this week, like Friday. So the fall weather is here early. And supposedly, Farmer's Almanac is saying we're going to have a fairly snowy and wet and cold winter, so get ready. Morning, Eileen. So we talked Friday about xenoestrogens. Hi, Holly. And xenoestrogens are in a lot of different products that you use probably every day. Nail polish and nail polish remover comes to mind off the top of my head. But scents, fragrances, things you spray in the air to make your house smell good, to make yourself smell good. Hi, Wendy. Is it cool in New York? It's cool in mid-Missouri. And so I kind of talked about DIM supplements a little bit on Friday, and I told you I'd follow up on that today. And specifically, I put my little broccoli picture up because if you eat enough broccoli, you might actually be able to protect yourself from xenoestrogens. The problem is not many studies, hey Linda, not many studies have been done in humans. So this is all kind of based on scientific bench research. There's no clinical trials, blah, blah, all that, all the stuff that we've heard about this entire year about how to fight this virus. There's nothing about this class today that's about the virus. I haven't done that for a couple weeks. There's not a whole lot of new stuff to tell you except the thing keeps going. So what we're going to talk about, oh, Holly, you know Wendy. It's interesting. Never know how people know each other. So what are DIM supplements? And why am I talking about broccoli? Well, for one, broccoli is wonderful, especially the way I make it. I hated it until I was about 30. It's one of those things that my mother would make me eat, and I would stick it in my mouth and never swallow it. And then an hour or two later, she would let me spit it out. But I got to the point when I was about 30. I don't know why it was 30, but about 30 years of age, I started really enjoying broccoli. And it's probably my favorite vegetable at this point. Okay, so why broccoli? Why Brussels sprouts? And there's a way to do that that's yummy. I learned that from a nurse practitioner years ago on how to make Brussels sprouts, so they're wonderful. Kale, yuck. So cruciferous vegetables. Bok choy, I use that in stir fry. So what you're after is a compound called diindolylmethane, or DIM. It's a compound that's created when you digest cruciferous vegetables. So they always mention broccoli and Brussels sprouts. So the research I'm basing this on, like most of them, is from the NIH and the NCBI, so the National Institute of Health. So it appears that DIM, so diindolylmethane, so we're just going to stay with DIM because my Missouri accent trips over that word. DIM affects estrogen levels in your body. And we talked Friday about xenoestrogens that are in plastic, petroleum products, etc., that you get exposed to all the time. The article I'm looking at is from July of 2020. So it's, 2 months old, basically? Actually, it's July 22nd, 2020. So DIM supplements have been gaining popularity as a potential treatment for a whole bunch of hormone-related conditions. So we're talking about acne, menopausal symptoms, prostate trouble, certain forms of cancer, perimenopause, estrogen dominance, which is the issue with xenoestrogens. You can get estrogen dominant from xenoestrogen exposure, and then all of a sudden you start having even the non-cancerous gynecologic problems that I treated for 30 years. Okay. So the question is, are these supplements backed by science? And the answer is no. So why am I talking about it? Because it's a potential way to balance estrogens for people that are worried about estrogens in general. So a lot of people will not take hormones. They've bought into the fact that estrogen causes breast cancer. I've talked about that before. If estrogen and estradiol, specifically from the ovaries, caused breast cancer, the highest risk age group would be 24 and 25-year-old women. They make tons of estrogen. Okay, so this is an overview of DIM supplements. You can get the same thing from cruciferous vegetables, but you would have to eat a mountain of them. Well, that's not true. You would have to eat them 5-6 times a day. And I like broccoli, but I don't want to eat it 6 times a day or even 5 times a day. I'll eat it once a day. So when you eat cruciferous vegetables, your stomach acid breaks down a compound called indole-3 carbinol to produce DIM. That's a new compound from those vegetables. So observational studies, which are not randomized, placebo-controlled, associate high cruciferous vegetable intake with a reduction in the risk of certain types of cancers, including breast cancer and prostate cancer. The mechanism's not known. It is felt that indole-3 carbinol is partially responsible for the reduction. Okay, so it appears that DIM supplements, limited studies, is thought to help balance estrogen levels in your body. Specifically, it is thought that DIM stimulates production of a less potent, more beneficial form of estrogen known as 2-hydroxyestrone. We talked about this Friday. Estrone is made in peripheral body fat. And estrone, I think, I may be wrong, is the issue with breast cancer. So I don't really think it's estradiol. Most of the women that are taking bioidentical hormones, 80% of their hormones are estriol. The only time you make that naturally is from the placenta while you're pregnant. So if you've never been pregnant, you've never been exposed to estriol unless you take a bioidentical hormone supplement or replacement. So estrone has always been, for me, the estrogen that's associated with breast cancer. And specifically on this one, elevation of 2-hydroxyestrone production in peripheral body fat may be part of the mechanism for the increase in risk of breast cancer that's estrogen receptor positive. And remember, there's estrogen receptor positive, there's progesterone receptor positive, there's both. So it appears that DIM may help reduce the effects of a stronger form called 16-alpha hydroxyestrone, which has been linked to weight gain, the risk of some cancers, including breast and uterine cancer. So the estrogen receptor positive cancers, so that's colon, ovary, uterus, breast, liver. In addition, DIM has been shown to inhibit an enzyme called aromatase. That's very common in the skin. One of the reasons I don't like testosterone creams or hormone creams that are given transdermally, because aromatase can metabolize those to different hormones and you don't quite know what they're doing. So for men on testosterone cream, aromatase activity that's high can convert testosterone to estrogen and lead to breast development, breast growth, breast tenderness, nipple soreness. So again, you would have to eat several meals containing cruciferous vegetables a day to get enough DIM. Okay, so a concentrated way to get DIM is by a supplement. I'll put one up, several actually, when I get done. So what are the uses? What's the potential benefits of DIM supplements? So they're being studied to look at their protective effects against certain cancers. They also seem to help with prostate enlargement, which is one of the reasons that older men have to go to the bathroom in the middle of the night and they feel like they're ragingly having to go to the bathroom and hardly any urine comes out, and it might take 5-10 minutes for that to happen. So prostate enlargement is a pretty common problem for men as they get past 50, 55, 60. So DIM supplements have been used for that, looked at for that, to treat acne, to aid with weight loss, and reduce premenstrual syndrome and menopausal symptoms. So I talked to a friend of mine whose daughter is having PMS symptoms. Usually that's from progesterone, suboptimal progesterone. I'm not going to say deficiency, but estrogen dominance, basically. So there's test tube and animal studies that suggest that DIM supplements may help prevent the growth and spread of breast cancer cells. Human studies still limited, okay? So here's the study. A year-long study of 130 women with breast cancer who were on anti-estrogen therapy in the form of tamoxifen were either given a placebo, so here's a placebo-controlled study, or a 150 milligrams of DIM twice a day, so 300 milligrams a day. So those supplements in those patients taking the active supplement resulted in a significantly improved ratio of 2-hydroxyestrone to 16-hydroxyestrone. So it appears that increasing the ratio of 2-hydroxyestrone to 16-hydroxyestrone may reduce breast cancer risk and have an anti-tumor effect. Then, 30-day study in menopausal women with early-stage breast cancer, 108 milligrams of DIM per day resulted in beneficial changes in estrogen levels. So DIM supplements in animal studies show potential protection against ovarian, prostate, and colon cancers. I forgot that estrogen-dependent cancer. But again, human studies are needed. And remember, this is a very inexpensive supplement. So there's no NDC number that can be trademarked and patented. So those studies are hard to do. They're expensive. There was a mouse study that showed protection against cervical cancer. That study was reproduced in 551 women with cervical abnormalities, the reason you get a pap smear. And taking 150 milligrams of DIM a day had no effect on cervical cell changes. Those are not estrogen dependent. That makes sense. Cervical cell changes are from the human papillomavirus. Okay, DIM supplements may protect against prostate enlargement and maybe prostate cancer. May. I'm not saying they do. It may help with prostatic intraepithelial neoplasia, which is a precancerous condition of the prostate. So in a 12-month study, men with high-grade pre-prostate cancer were given either a placebo or 900 milligrams of DIM per day. And so those on DIM, between allergies and my medications, I do have that non-productive cough. So those men experienced significant improvements in prostate health and reduction in prostatic intraepithelial neoplasia, which is precancerous. Okay, again, more human research. How about weight loss? So estrogen plays a fairly important role in regulating fat accumulation. So DIM supplements may aid in weight loss. Again, human research needs to support that effect. But studies that link an imbalance of estrogen, so too much or too little, and estrogen, testosterone, progesterone, all hormones, you can have too much or too little, both of which have side effects or problems or symptoms. So an estrogen dominant or a lack of estrogen may lead to an increased risk of weight gain in men and women. So DIM supplements may stimulate fat breakdown and inhibit fat cell formation. There's a whole lot of other stuff involved in that, but that's one option or one potential mechanism of action. Okay, what are the other potential benefits and uses of DIM? Well, those supplements may fight acne. So of course, when I was a teenager with lots of acne, If my mother told me to eat a whole bunch of broccoli, ain't no way that was going to happen. I hated it. But then I learned how to cook it so that it's wonderful. So I do have a recipe for broccoli if you just hate broccoli. So DIM supplements are used to treat hormonal acne. No research currently supports this use. So there's that. It may reduce hot flashes. So a lot of women in perimenopause, usually after the age of 38 to 42, certainly in the 40s, start having hot flashes. That is a reduction in estradiol levels and potentially estrogen. Um, Estradiol, I know more about as far as levels. So if you're under 50, you're going to get hot flashes, and that's ovarian dysfunction. So women lose some of their fertility because they're not as good as producing estrogen, certainly estradiol from their ovaries, as well as progesterone. So that's that imbalance. So hormonal changes lead to hot flashes. I've spent 30 years dealing with perimenopause and treating that. So DIM supplements are used to reduce hot flashes. No research supports that. And we'll talk Wednesday about natural ways, including DIM, to balance your hormones as you get into your 40s. Okay, DIM may reduce and relieve premenstrual syndrome symptoms. So those tend to be related to estrogen levels, and to me, it's more progesterone suboptimal levels after ovulation, if that happens. So lots of women in their 40s do not ovulate every month. They get irregular menstrual cycles. Progesterone itself, there's a progesterone cream I've recommended for 24 years that seems to help. It's over the counter. It seems to help with PMS symptoms and perimenopausal symptoms. Okay. So research, again, has not proven that DIM supplements help reduce PMS symptoms, but it is a very inexpensive way without having to take a prescription medication. Also, DIM may help reduce estrogen imbalances in men. So higher levels of estrogen, so think about the testosterone to estrogen conversion, may cause breast growth, erectile dysfunction, and infertility. DIM supplements may be effective, have not been studied in humans for those issues that I'm talking about in men. So due to a lack of research in human beings, little is known about the long-term safety and side effects of DIM supplements. However, if you eat cruciferous vegetables, you will make this compound. So it's not an unnatural, weird thing that your body and brain doesn't, and stomach and intestine doesn't know what it is. Okay, so current research based on what we talked about earlier, there appears to be no toxicity, no serious side effects of DIM. The most common side effects are darkening of the urine, some increase in bowel movements, maybe headaches, every medication, and gas, every medication. Less common side effects are nausea, vomiting, diarrhea, and skin rash. And of course, anything that all of the supplements that I usually recommend are vegetable-based. So they're gluten-free, they're vegetable-based. So as DIM levels interact with estrogen levels, that may affect people that have a hormone-sensitive cancer. So you shouldn't do that. You shouldn't take a DIM supplement without talking to your healthcare practitioner, especially if you are dealing with an estrogen-dependent cancer. Okay? So it's worth having a conversation with a healthcare practitioner before you do this, because you are potentially improving your estrogen levels, and based on your medical history, that may not be in your best interest. So how much should you take? Nobody knows. All the studies, 108 to 900 milligrams a day, all of those studies were done to treat cancer, and people with prostate enlargement. So there's a study of people, healthy people, that showed that DIM doses up to 200 milligrams were well tolerated with no side effects. One person had some nausea, headache, and vomiting after taking a 300 milligram dose. 300 milligram dose. So higher doses may be associated with side effects. Okay. Other uses like acne, weight loss, etc., have not been studied in humans. So again, talk to a healthcare practitioner. So what's the bottom line? What's the deal? So DIM's a compound that your body creates when you eat cruciferous vegetables. It's also concentrated. It's sold as supplements. I looked up before I put that broccoli picture up. I'll bet I had 100 screenshots of DIM supplements from different companies. So there's lots of DIM supplements out on the market. I did talk to a fellow health coach 6-7 months ago whose practitioner recommended DIM supplements. I think she's in her 40s, so perimenopausal potentially. And she was asking about what I thought about that. It's actually one of the reasons I decided to look into this. I've spent so much time talking about cholesterol and heart disease and supplements for this and supplements for that and COVID protection and immune boosting and all that. I finally got to the DIM supplements. Again, talk to somebody who knows what they're doing. Of course, finding a healthcare practitioner that knows something about DIM supplements, which until 6 months ago, I didn't until my healthcare coach colleague mentioned those. So regardless of whether or not you take DIM supplements, everybody knows from your mother and your grandmother to eat your vegetables. So broccoli is good for you. Brussels sprouts are good for you if you cook them right. Broccoli is really wonderful if you cook it right. Kale, not so much. Bok choy, stir fry, it's wonderful. So broccoli and cruciferous vegetables are rich sources of nutrients, fiber, antioxidants, vitamins, and minerals. So you really can't go wrong by eating them. And they may help balance your hormones. So we'll talk about other natural things you can do to balance hormones. We talk about hormone balance. It's all about balance, I think in April maybe early May. And we talked about estrogen, progesterone, testosterone, thyroid, DHEA from the adrenal. And there's ways to do that with bioidentical hormones as well as supplements. We're going to talk about natural ways to do it on Wednesday. I've got a little plan in my head. And Wednesday, maybe later in the afternoon. I think I'm running to St. Louis Wednesday morning. So I'll let you know when I'm going to be on live doing our class. So have a great day. It's a great fall day. It's sunny, it's cool, crisp. My favorite time of year. And I will talk to you all on Wednesday. Peace and health to you all, and I'll see you later. Bye.